Hey everyone, Dr. Gallagher here from Maragal Medical. This week we're going to be talking to you about one of the treatment options that we have for injection therapy. At our clinic we talk about all of the available treatment options, and when it comes to injections, we really have four types of injections. We have what are called the regenerative medicine injections, which are the stem cell injections and those PRP injections to help with repair and damage, as well as intramuscular injections called trigger point injections, and then those sacroiliac joint injections. This week's focus is going to be on the trigger point injection. That's an intramuscular injection, and you're going to want to stay tuned for all this additional information. All right, Dr. Timothy Gallagher here. I'm in Alexander's injection room. Alexander Gimmelberg, our colleague, is our physician assistant, and he's in charge of all of the injection therapy that we do here at Maragal Medical. Alex came to us about 4 years ago with a long history, primarily in orthopedics, and he's literally done thousands of these injections. And Alex, I was telling the group here, the audience, I've been having a lot of trouble the right side of my neck. Dr. Davis had been having a little trouble getting a good adjustment in. So we're going to do an intramuscular injection called the trigger point injection to help to try to loosen that up. So why don't you explain to the group the steps that are involved with this type of injection?
I will palpate the area and identify this is the area that painful area. And then I will inject it with a pitcher plant extract called sarapin.
I think it's important for the group to know as well that we really pride ourselves on using natural substance whenever possible. So a lot of clinics will use lidocaine, some clinics cortisone, where it's actually more destructive to the tissue. As Alex pointed out, we're using a natural product from the pitcher plant called sarapin. No contraindications with this type of injection.
Okay, let me palpate your upper trap.
I
can tell.
It's pretty easy. I think they can see it on video. Now that's a knot. I hope I don't bend the needle.
Okay, let me mark the area.
Yep.
And we'll do the injection.
Great.
Okay, on 1, 2, 3.
Now it's funny, we use a real small gauge needle. I couldn't even feel that going in. Usually when he injects, what I'm feeling now is just a little pressure into the muscle, but that's it. Yeah, very straightforward. Typically, these injections are done usually on a weekly basis, and the number of injections just depends how chronically tight the muscle is. I think on average about 3 to 4 injections per group over the course of 3 to 4 weeks. And again, already starting to feel a little bit looser, no pain whatsoever. This is a common injection, and again, at Maragal Medical, we're a full service physical medicine clinic. We take most insurances, so this injection is typically covered as well. Thank you so much, Alex. You did a great job.
You're very welcome.
I know Dave's going to have a much easier time, Dr. Dave, adjusting my neck when I see him in a few minutes. Thanks, everyone.
Have a nice day.
Wasn't that great information? I think you all now have a better understanding of the intramuscular trigger point injection. And again, we like to emphasize when we do these injections, we really make sure that we're looking at all holistic options. Remember, this injection is completely natural. It's used from the pitcher plant extract called sarapin. So there's no chance of any adverse effects from the injections or contraindications. It's plant-based, so it's naturally going to help to loosen those muscles. Our clinic's pretty unique, where we've combined both medical care, physical therapy, and chiropractic all under one roof, and there are a lot of treatment options available. And if you'd like more information about our practice, feel free to check out our website at maragalmedical.com. Well, that's it for today. I hope you learned something, and I hope you have a great day. We'll see you again next week.